Welcome everybody. Hi there. Good to have you all here today. It's a beautiful sunny afternoon where I am. I hope it's lovely where you all are. We're just going to kick off now with our session around workforce employment and skills as a lever for change in anchor institutions. My name is William Roberts. I'm part of the team at Innovation Unit who are running the Health Anchors Learning Network. Just to start with some basic housekeeping this morning. So firstly, if you're having any technical difficulties and there's any problems, my colleague Gweno Edwards is here. Do send a private message to Gweno via the chat function if you have any challenges. I'm guessing everybody now is so well versed in Zoom that I'm not going to have to run through too much of this, but to let people know that we are going to be recording today's session in the first part of it because we want to be able to share it with those who couldn't attend today. For those who are staying on for the second half, we won't be recording that. It's a slightly safer and different, more intimate vibe, so we won't be doing that. We will be using Slido shortly and throughout the session to be able to do some questions and interactive polling with you. Today it's www.slido.com and it's hashtag Hound2. Up in a moment and hand over to my colleagues, but today we've got some exciting people speaking to you today. So we're going to open up with Jacquie, who's going to talk about some of the work being done across England to really think of the policy at a national level, at an England level there. We're going to then hand over to Preeti, who's going to talk about the work that's happening in Mid and South Essex hospital groups and a bit across their system. And then Ruth, who comes from Lancashire and Cumbria, is going to talk about the work they've done as a system responding to employment as an anchor. So moving on to what today's session is going to look like, I've talked a little bit about that. For those of you that are staying for part two, there'll be a short break for about 5 minutes between 2 and 10 to 3, where you get a chance to just go to the loo, get a drink, but also reflect a little on the first session. So the first thing I would like you to do is, if you have Slido open, please go over to www.slido.com, enter the code hashtag Hound2, and we've got our first question of the day. And what we really want to hear from you today is for you to sort of say, what are the big questions you're bringing today? So what are the things you're interested in today? And what are the questions that you may have around anchors, employment, skills, etc. So I'm going to give you a moment or two just to start filling in those questions. And we'll let you do that. And then shortly we'll be handing over to Jacquie. So Jacquie, I'll be coming to you in a moment.
And William, we've had a couple more people join in the last few seconds. So if you wouldn't mind just repeating that last section and we can move on to Jacquie.
Yeah, absolutely. So welcome if you've just joined us. Head over to www.slido.com, enter the code hashtag Hound2, so that's HALN2, and then type in for us what big questions you're bringing today to there. So I can see already we've got some really interesting questions coming in here. Getting senior management buy-in to do it properly, what works well, how we ensure social care as well as healthcare is represented, where can we make the biggest impact, what roles ICS can play, some of the things to avoid. So yeah, absolutely, some of the not so good learning. So there's some questions going in there. Please do keep typing in your questions. And Jacquie, I'm going to hand it over to you, where you're going to talk to us a little bit about the work you've been leading and some of your thinking at a national level. So over to you, Jacquie.
Thank you, William, and hello everybody. Really great to be here today. I guess my big question before I get started, pretty much the same as all of yours. What are the big things, or things that will have the biggest impact that we can try and do, and what is it from my perspective, particularly today, hearing from you and learning from the work that you're all doing, what could we do in England to progress and to help enable the right things to happen in as easy a way as possible. But just to go back to who I am and what I do and why I'm here today, I am the Director of Workforce Strategy in NHS England Improvement, and my role is to really think about what do we need to think about for the future for our workforce. and the big changes we want to try and support to be able to be delivered locally. So we wrote, for instance, the 2021 People Plan, and the big themes that came out of that, including looking after our people, how we help people to feel like they belong, how we actually look at new ways of working, and how do we grow for the future. And those 4 themes are still absolutely relevant, we think, now and going forward for the future. But we also know, and it's great that some of the questions have been about social care, particularly with the advent of everywhere being covered by an integrated care system. What are the opportunities and the benefits that we can see and feel, and that people locally can see and feel, from individual organisations, from local partnerships at place, whether that be the NHS with local authority, almost as civil partnerships, and what at a system level are some of the opportunities and benefits that we could see to leverage all of these opportunities for our local people. So just thinking about the sort of purposes of an integrated care system as well, before we get into some of the specifics, because I think, again, this really speaks to why anchor institutions and the opportunities, thinking about the system role in that, can really support the progress that we're wanting to make. The 4 core purposes of integrated care systems have been set out as improving population health and healthcare, tackling unequal outcomes and access, enhancing productivity and value for money, and helping the NHS to support broader social and economic development. And I think, I hope you'd agree that actually our people across health and care partnerships and across health and care organisations are the ones who will deliver those outcomes if we enable them to work in the right way. But they are also, our people, a really key outcome for us to work towards. So how can we, as we set out in the NHS People Plan, but how can we across the totality of our people and our workforce think about the outcome we're after, about more people working differently in an inclusive, compassionate culture? What does that mean, and what's the role of anchor institutions and partnerships to enable us to drive that forward? We've obviously also know that in terms of the wider determinants, employment is one of the big factors around keeping people healthy and well. And we know that our local populations are generally our local workforce, who often come with some of those biggest health inequalities. So anchor institutions and employment of our local communities are all part of those 4 purposes, those 4 outcomes that we're all trying to drive towards. And of course, what we also know is that quite often, and particularly now with COVID, the NHS and public sector generally is often the biggest employer in local places. And whether that be directly or through the supply chain in terms of services that are provided to the health and care sector. So how can we, and this is what we're trying to do right now, and again, why it's great to be here today to hear from you, how can we capitalise on that? How can we capitalise on the increased labour market? How can we capitalise on people who've gone into some of the roles right now, such as the vaccination programme? And how can we match people locally wanting jobs with skills and competencies that are needed across a local footprint? So I heard from, and I'm going to steal Jacquie Daniels' words here, I heard from some areas locally about one of the key benefits of having a local workforce is obviously they know local communities much, much better. And they represent and are really helping to drive that diverse, inclusive approach to how we support both our patients and the people who need our support and care in a more personalised way, as well as how we ensure we have the right workforce for the future and the talent that we need to nurture. And Jacquie, I thought, articulated this beautifully from the Newcastle work, whereby they see that their civil partnership across the NHS and public sector within the Newcastle footprint brings with it the employment of local people, brings with it the pride of local people, and therefore the staff to do the right thing for their local communities and recognise, because they live with it and they see it in their daily lives, they recognise the importance of needing to take action on significant local deprivation within the footprint in Newcastle. So for the Newcastle Partnership, employing local people who are their local communities drive all of those outcomes that I mentioned earlier that we're seeking to enable. And I completely appreciate, I'm probably talking to the converted here in terms of why this is important, but I just think this is from our perspective nationally, why we think it's important in England to be able to do whatever we can to enable you locally to make the right progress and to facilitate any of the levers we can, but also remove any of the barriers that are getting in the way. And I guess some of the benefits at a sort of system level, and I'm sure Ruth will come on to this shortly, but what we also want to sort of see is that we don't keep having this competitive approach to almost robbing Peter to pay Paul with needing to find the people, the workforce that we're after. How can we stop, for instance, overinflating pay just because we need to bring people into the organisation? How can we actually have equity and levelling up of T's and C's so that we are actually supporting all of our people in a more equal and fair way? How can we grow our own workforce so that we can support that economic recovery at a system level that might have different hotspots within that footprint? And how can that whole partnership support those individual hotspots, making the fastest progress that it needs to? And how, for instance, can we support staff who don't have access to good people services because they don't have a robust HR and OD function? How can we support all of the people within a footprint to have access to those sorts of services? And I guess one of the biggest ones for me is the opportunity, and again, thinking about how we can support people to come into health and care organisations. How can we support a more flexible and diverse opportunity in terms of career progression, so that we don't bind people into one profession, we don't bind people into one job or one organisation? Could we have a more diverse approach to moving into where the right skills and the right people are needed at the right time? And there's lots of different examples of where this is already happening. And I think what we want to understand nationally is how can we capture the magic of how it works and support everyone to be able to do this everywhere, get them the best possible benefit. So just some examples again that undoubtedly you have all heard about: the Devon single recruitment process, the work that's been done in Greater Manchester to have a one people focus and a one people support offer for their health and care footprint, and some I've already mentioned the Newcastle example, and also a really great example actually that William shared with me earlier this week, whereby voluntary sector organisations who are too small to do some of this themselves, clubbing together as a partnership to be able to think about, again, how we can have this ethos, that the outcomes that we're after, for all of the people that we're talking about, not just those who work in large acute trusts, which has often been our focus. I think I'll just stop there, William, and reiterate why I'm here, I suppose, which is to hear from you. We know this is really important. We know there's a great opportunity right now to capitalise on things that have happened as a result of COVID, and we want to know how best we can do that. So how can we support you to do the things you want to in this space? And I will stop there.
Brilliant. Thank you, Jackie. And I think the sheer scale of what you're trying to achieve, I think, is huge, but also the opportunity to start somewhere and get going from some of the examples you gave sounds really great. Preeti, I'm going to come to you. We're going to just give you an opportunity to get your slides ready. So we'll do that. You've probably got a few questions coming into your head if you're a participant. So feel free to either use the chat function or also Slido, www.slido.com #Hound2 to ask questions. Preeti, ready to go, and over to you. Lovely to have you here.
Thank you, William. Thank you, Jackie. So my name is Preeti Sood. I work in Mid and South Essex Foundation Trust as Head of Strategy Unit. So as you can see, I'm not from Workforce. However, the work on Anchor program within MSc FT and MSc Health and Care Partnership is being led through our team within the hospital. And I have a few slides to share just to give you a bit of practical examples of what we've been doing, something which I think is a little bit different. But before that, I thought one of the things that most people ask us is, how did we arrive at this as a solution? You know, why did we start thinking about Anchor? Why did we start thinking about specific aspects of Anchor? So I think over the next 5 minutes, I'll spend some time trying to take you through our journey and then share the slides, if you bear with me. So as I said, I work in the strategy team. Charlotte Williams, who's our director of strategy, in June of 2019 got involved in the work that Health Foundation was doing at that point in time, trying to gather evidence around anchor institutions and what would it mean for NHS to be anchor institution. And the work got published, as you know, in a report in August of 2019. When we looked at the evidence in June, July, we were thinking about what would it mean for us as a foundation trust. And from a contextual perspective, I mean, if you've been here since morning, you realize this is all, context plays a big role. So from a contextual purpose, Mid and South Essex has a population of 1.2 million. We are somewhere between London and Cambridge, if you know, from a geography perspective. We have 12 districts, multiple district councils, a county council. We used to have 5 CCGs, now it's 1. We were 3 district general hospitals, Basildon, Southend and Broomfield, and we merged on 1st of April 2020. So in 2019, we were working as a group of hospitals, a hospital group. Most of our population, like in many parts of England, is between the 16 to 64 age range. So 60% of our population is in that age range. 16% of our population lives in rural area. 3 specific districts have higher deprivation than the England average. So Basildon, Southend-on-Sea and Thurrock. We as a population are 11% ethnically diverse. However, that changes. So across Mid and South Essex, it's 11%, but in Basildon and Thurrock, it's more, much more. And also it changes when you compare the ethnic diversity of our own staff within the hospital. So we are more ethnically diverse as a hospital staff compared to our population. As one of the biggest employers in Mid and South Essex, we employ 15,000 staff. It would be around 17,000 because not everybody works full time. So around 17,000 individuals, but across 15,000 posts. So I hope that gives you a little bit of background of where we are coming from. And as with most of the stuff, we started looking at our own data, and I'll share something with you in a bit. And we then took that data and engaged with our own kind of directors of nursing to try and understand what is this data actually telling us about our own staff, about our own workforce. We also explored, had some exploratory conversations with our partners. So being in strategy team, that's one of the benefits that we get. We get to do a lot of exploratory conversations before we do anything, embark on a program of work. And in October of 2019, we brought both internal and external stakeholders together in a room. That was a different world, as you can imagine. We had 30 people in the same room. I miss those days. And this, when I say internal stakeholders, I mean our own HR team, organization development team, estates, and facilities. So various departments within the organization, plus partners like the councils, community and voluntary sector, CCG, primary care, other, the wider partner group. And we asked 4 questions. One was, what do you think about anchor? Does it make sense to us, as a big group of stakeholders? People said, yeah, makes sense. Question number 2, if that makes sense, does it make sense for us as a hospital group to lead on this piece of work? Because obviously, councils know more about social value. And everybody agreed that yes, it made sense for the hospital group to lead on it. Then there were various reasons for it. We, as I said, one of the biggest employers. We are, as you know, anchors about that sticky capital. So we are that big building on top of the hill or on Prittlewell Chase in Southend. So yes, it makes sense. And we have a good reputation at a place level. Question number 3 and 4 are like A and B. So it's, yeah, so if those 2 things make sense, which place, where should we start? It's like, if you're going to do an experiment or pilot it out, where do we do it? In a place and in an area. And because of various reasons, and some of it was what our local need is within the hospital, within the locality, and also being a bit opportunistic, we arrived at employment as our workforce as our main focus area, and Basildon as the place where we will do this. And I'll show you some data when I flash the slides around why Basildon and why employment. And that is the start of the program. So October of 2019, hospital as an anchor institution, focusing on Basildon and in workforce as kind of our focus area. That is where we started. So by Feb of 2020, we went around, spoke to our directors of public health in various councils, and some of the other partners who put their hands in their pockets and said, yes, here you have some funding, let's start, let's do something, let's look at something very tangible that we could do as a partnership to try and understand what would it actually mean to be an anchor institution, and what would it mean for NHS to lead that bit on behalf of various partners. And then March of 2020 happened, rest is history. However, July of 2020, we realized that there was a lot happening at a place level and we couldn't keep the anchor institution work paused. We had to revive it. So since July, August last year, we've revived the anchor program after it went for a pause in March of 2020, and we have delivered. And I'll show you some numbers in terms of what do I mean by we have delivered. And the partnership has become more stronger. We've got more people around the table, departments of work and pension, more engagement from our community and voluntary sector organizations since July 2020. So lots of positive has come out of the pandemic for the anchor program. And as I mentioned earlier, it is about internal and external stakeholders, and anchor is a team sport. So whatever I'm saying here is on behalf of that team, which is sitting kind of supporting us doing this. We started without a budget, with me and Charlotte thinking about, yeah, this is like, 0.01 day of our life in a week. And it has grown. We've managed to get almost £250,000 into this program. We now have 2 team members who are supporting, kind of part of the anchor program team. One of them started this week, one started last week. So that's the kind of journey, and I would say it is a 15-month journey because we've kind of paused and started and paused and started. So that's where we are. If I could quickly share my screen, and William and Gweno, please shout out if I'm taking more time than I should.
You got a few minutes left, Preeti.
Sorry, William?
You just got a couple of minutes left, so keep going.
Okay, perfect. So very quickly, the anchor program, this is what it includes. It includes widening access to quality workforce. You would have seen all of this evidence. And so under, how do you build your future workforce? How do you widen participation? How do you be a good employer? But these are the other bits. So we also have another bit around environmental impact, etc., which we're not talking about today. And it looks very neat, but trust me, it is not neat. This is what it looks in the background, because this is all about connections. As I said, it's a team sport and it's about partnership and connections. This is the dashboard I was talking about. So the workforce, we built this workforce dashboard. We took it to our dons to say, we have 60% of our staff who work locally in Basildon and live locally in Basildon, who live in the bottom 2 quintiles. What does that mean? And what can we do as an employer? So this is the third aspect of being a good, the third evidence based around being a good employer. And we soon realized that some of it is because we have specific ethnic communities that live in those areas. Some of these areas are in walking distance to the hospital, so cheaper to travel, cheaper to rent. So that it's a quid pro quo. So if you are in a low-paying job, it's easier for you to live in one of these areas, not because you want to live, but because it's cheaper and easier to travel, and it supports your earning and your kind of family's living chances. But then it has a negative impact on life chances of our staff. So we were exploring this, and one of our partners, Anglia Ruskin University, we went to one of their sandpit events, which is kind of an innovative way of saying this is a problem question, what should we do? And what we came out from there is we have co-commissioned. So Anglia Ruskin and us have put money in a small pot where we are doing 2 pieces of research. One is an ethnographic research, trying to understand what does it mean for staff who live in Basildon and work in Basildon. What does it mean? What are the dynamics that affect them? And then we're going to use, and we've started conversation with our council partners around how do we use this to develop, feed into some of the work that councils are doing around safe traveling, active traveling, street lights, greenery, etc. And what can we do so that we're not only talking about or thinking about our staff once they enter the corridor of the hospital, we're talking about their kind of life chances as a whole for them and their family. And the other piece of work that came out of this was around trying to understand what does it mean to be an employee and an informal carer, and what could we do at a policy level, how do we run our shifts, etc., to support our own staff. So these are the two pieces of research that came, kind of pragmatic research that have come out of that piece of work. And then the second piece, I mean, there are lots and lots of examples, but the second piece which I wanted to highlight was around the future workforce. So there's lots happening around our work with DWP to recruit at system-wide initiatives. Jacquie mentioned a few where we are recruiting on behalf of the system because it's easier for us to kind of market a job and get health and social care workers rather than a care home or a GP surgery. So we are doing that on behalf of the system, and there are lots and lots of system-wide initiatives on recruitment and retention. But we thought there was this place where we could have some positive influence, which was building the future workforce. And when we looked at Basildon data, we saw that Basildon as an area had low aspirations compared to the whole of Essex and even England. So we were trying to understand, so what do you do with it? And within the strategy team, we also host the Mid and South Essex Innovation Program. So we run Innovation Fellowship where we have amazing innovations that come and want to work with us. And one of the fellows, Dr. Hina Rafiq, had an innovation which is called Generation Medics. It's an online platform which helps engage and provide support to help widen participation in health and care careers. So children who would have never ever thought about health and care as a career, or even going to university or studying further, I engage in this online platform, and they get mentoring support, they get support with CV writing, applying to universities, etc. And when we started this piece of work, there were kind of face-to-face career workshops, which then very soon got converted to virtual career workshops. And the program is also running a virtual work experience placements for children from Basildon schools. And over the last 6 months, so we restarted it in August, and by March, we had 300 children engaged on the platform, 80 of them who then got into the paid version, so the kind of more support online, and 45 children who have been placed in a virtual work kind of placement within the hospital or within a service. And that's not the only piece of work. We're exploring how we can take this further with pupil referral unit, some of the work we are doing with youths who attend A&E, how can we link this into that program as well. And we're also looking to work with a local college and learning from the work that Essex County Council did around supported internship for young adults with learning disability. So they come on board on a 12-month internship and are placed in various services. And it's not about what they will get out of this. I think for us, the bit is what will our services get out of this? Because I think this is an opportunity where, while we are supporting interns with on a learning disability spectrum, we're also helping our services understand how to be more inclusive and how to work more inclusively at a service level. So as I said, just a few examples, not extensive, and I know I've overshot my timeline, but I shall stop sharing my screen now.
Thanks, Preeti. So that's brilliant. A lot in there, a lot about bringing people together, following the data, and doing a quite structured program of work around this. Ruth, I'm going to come straight to you because I'd like to give us a bit of time. But if you've got burning questions, don't worry. There is some Q&A time, and we'll have time during the second session for a bit more in-depth discussion. So Ruth, over to you.
Hi, everybody. Can you hear me okay?
Yeah.
It's lovely to be here. Thank you very much. So my name is Ruth Keeler. My job title is that I am the strategic lead for careers and engagement across Lancashire and South Cumbria ICS. And this is a role that I've had. It's been running for the last 2.5 years. But for 5.5 years, we've been delivering careers and engagement activity across Lancashire and South Cumbria, and reaching up actually to cover a lot of Cumbria as part of the footprint, because North Cumbria does not have any careers and engagement team. But a little bit just about the context in terms of our geography, for those of you who aren't aren't sure about Lancashire and South Cumbria, it's an absolutely stunning place. But we sit just on the M6 corridor, which makes GM and also Cheshire and Mersey really close for us. So we really struggle with some of our recruitment. And some of our other concerns would be that I'm based in Lancaster, and if I travel less than 10 miles, 5 miles down the road, I can decrease my life expectancy by 10 years. So we do have significant areas of deprivation across Lancashire and South Cumbria. So whilst it's absolutely stunning, it's also a really challenging area to work in and to try and improve the healthcare that we deliver, and also the recruitment that we undoubtedly need, because as like many of you on the session today, we really struggle with different areas of our recruitment. And as Jacquie mentioned earlier, we really struggle with the whole robbing Peter to pay Paul. I know there've been lots of comments on the Slido about social care, and it's one of the things that we've been looking at across our system, is how we work system wide, how we really do think about social care as part of the health and care offer that we have, and how we work together in partnership with our colleges, with our LEP, with our universities that we've got locally, etc. as well, and really think about how we can join the dots really. So the careers and engagement work over the last 5.5 years or so has basically, under the umbrella of widening participation, running employability programs, supported internships, step into work programs, lots of different types of placements, work experience, all of those kinds of things that Preeti mentioned earlier also. And we've been delivering those system-wide, but in silos. And for the last 2.5 years, I've been coordinating that work and trying to make sure that we create more equity across the system and we reduce the inequalities and the gaps that we have. So this time last year, obviously, we were just in the throes of the beginnings of the pandemic. And by August, we had over 15,000 people across Lancashire alone who'd been made redundant, which was really significant. And that number only increased throughout the autumn. So it became clear to us that we needed to offer and to do something different with the numbers rising, and obviously the health inequalities that would lead to, etc. And as people spend longer times having been furloughed or having been made redundant, they get further away from the labour market, as we know. So in the middle of November, we were told locally that we needed to, that we needed to open and deliver mass vaccination recruitment. So obviously this was a concern, and we knew that that meant that we had a number of vacancies we would need to recruit to at pace, really. And we were really quite well placed locally to do that across Lancashire and South Cumbria, because we were able to use the volunteer pipelines to support the mass vaccination centres with marshals. And we also, because of the commitment towards employability and recruiting from our local communities we already had, we knew that we could use our redundancy pipeline to kind of kickstart and to recruit to the admin and clerical roles. Now, I make that sound really easy, and in some respects, it was quite easy, because for the last probably 3.5 years, we've been working in partnership. So we have had a very long journey of building relationships and understanding priorities across our different providers. We have had a shared vision of how we can support people within our community so that they don't fall through the cracks and get further away from the labour market. And as I said, for the last 3.5 years, we've been working with the LEP, we've been working with the NHS in terms of acute, primary care, social care, our education providers locally, and our DWP and Job Centre Plus colleagues as part of a health and social care skills partnership group. So it seemed that we already had made the connections, we'd done the groundwork, and it was quite easy then to pull together a new programme to recruit for the admin and clerical roles. So what did we do? How do we get started? Okay, so first thing to say is that this wasn't a mandated decision, but neither was it a huge visionary decision that somebody dreamt up. It was a natural progression from work that we'd done already. And that is to create a flexible and opportunistic pipeline which worked for everyone. So it would work for our providers, our education providers, who were able to co-design with us a short 2-week program. It was easy for us then to join the dots with that and to move toward basically working with the job centres. They would send through those people who had been recently made unemployed, and we were able to do that really through our redundancy task force. So I suppose the order of things was that we were first of all asked to deliver mass fax recruitment for the mass fax centres. We knew that it would be very easy to specifically target those people who'd been made redundant or long-term furloughed. They would have the skills we would need for the admin and clerical roles, and as I said, the volunteers and that pipeline for the marshals. And really what we did was we decided to choose 2 of our providers to be kind of the centre of this pipeline. And the job centres funneled through and signposted those people that I've said who'd been recently made redundant and long-term furloughed. They signposted those people to a specific email address. From there, we had programs running, so specifically focusing on information governance or IT skills, communication skills, customer service, those kind of things, which we knew we would need as part of the vaccination programs. And then what we did was people who particularly wanted to apply for the roles, we made sure that we had changed the person specification so that we didn't include lots of big qualifications and you need a degree and you need this, that and whatever. We actually just focused on skills and made sure that they had a reasonable standard of English and maths, so no formal application forms. And what that did was reduced all the bureaucracy that people usually have to navigate in order to be employed in the NHS or to work across health and care, and really speed things up. But it also broke down lots of barriers. It broke down barriers for our education providers and also helped to build a relationship for us, because we were able to just say, this is what we really need. We need people who can speak to their own communities, who can be welcoming, who can understand spreadsheets, etc., for whichever one of the jobs it was or the roles it was, and actually who are going to be really engaged in this. So lots of people were going to benefit. When let's call them learners, so when the learners went on program, they were then filtered. So those people who weren't really job ready and would be able to hit the ground running, they were filtered into a longer program, a longer employability program with us. And those people who were absolutely going to be able to hit the ground running and who were job ready were filtered through to be able to apply for a role with us in the mass vaccination centres. We created a really quick portal to be able to host the interviews. Applicants booked slots, and then we held a normal interview, but we tried to keep it quite informal. Actually, we knew we needed people who had the right values, and the rest we could work with because we already knew they had the baseline skills, if you will. Cohort 1, we decided on a threshold of in terms of marking criteria to make it really easy, and the applicants found out within a few days whether they were successful. And cohort 2, because we learned and we'd done some PDSAs and learned from cohort 1, we were able to actually decide on the day and give the applicants the successful news and the congratulations there and then, pretty much. What else? Let me just think, what else did I want to do? Yeah, so this was really about joining the dots with work we'd already done. And in terms of why it mattered, so there were lots of reasons why it mattered. The main reason was obviously the people in our communities. So this was going to benefit people from a holistic perspective, build confidence, raise aspirations, but also it showcases opportunities for us across health and care, gets people thinking about working within health and care with the NHS and the mass fax centres, which was obviously pre-Christmas. Everybody was talking about it and still are on a daily basis, and get them, you know, to start engaging with the community in a different way, but also thinking about opportunities with us, which maybe they didn't think of before when they were working in different sectors. There's an obvious economic benefit to that. There was a huge benefit to us in terms of being able to staff the mass vac centres, but also to be able to help our communities in terms of the economic benefit. And then partnership wide, what it did was stop that whole revolving door of people jumping onto programs and, you know, just being able to pull down funding for partners and then move them on to the next bit of the carousel. Actually, this was a really good way for our education providers to work with us in partnership rather than all of us working in silo across the employability agenda. And have a really collaborative, committed approach to what we are going to do in terms of serving our communities and becoming an anchor for employability opportunities. So it really strengthened our partnership working and the ability to do something meaningful. We all felt that we'd done something really special by kick-starting this pipeline, which of course is only a pilot. As you can see, outcome-wise, we had 141 recruited to the programme and interviewed, and of those, we give contracts to 121 of the learners. So those who were not successful, we refunneled those through. They then were able to participate in further programmes with us in order to get them closer to the job market. But then obviously what it has done is to showcase the benefits and the strength in working in partnership. So we have really cemented our relationships with our partners. And it's also been able to make sure that when we are talking about system-wide opportunities, we are thinking system-wide. So when, you know, we're talking with the county council and they come to our social care skills partnership group, we're talking to all of our colleges, they're there, and we're trying to understand how we can work more successfully in order to get better outcomes for our communities. And then the final thing in terms of outcomes is we showed that we don't need all of the bureaucracy. We don't need lots of red tape. We can be really flexible. And I think that's really critical in terms of how we take employability programs forward. Next steps wise, it's as you can see on that slide, it's working with partners to explore new ways of how we work together to benefit our communities and each other, because at the end of the day, a lot of our partners are businesses. And also it's looking at other opportunities such as Kickstart, working with our NEETs, creating opportunities for carers, etc., across the range of careers opportunities that we have, and how we can just be a bit more aligned in our approach rather than, you know, competing with one another. And that's it for me. Thank you, Gweno, for holding this slide.
No problem, Ruth. That was great. Thank you very much. Right. We are coming towards the end of our time for the first half. I can see a huge number of questions in both Slido and also in the chat box. So I'm thinking we may have to direct some of those to you both individually and actually perhaps produce a document afterwards that helps people to actually go away with some of those questions, because there's some really good but detailed questions in there. I guess the sort of three things I take from this is like, gosh, there's a lot you can do. Secondly, it's about how do you sort of build on what you've already got and get people in the room and build those relationships. And the third, really, about how do you really sort of focus on a laser-like way on what's going to make the biggest difference in the first instance or the opportunity you have in your local area. So I'm gonna just put one question back to each of you. So for those of you who've got to drop off, please do. I know some of you are holding until 1:45. For those of you who are coming to the second session, we will give you a little break between this and the second session, and there'll be an opportunity to have a bit more small group discussion for that. So there'll be an opportunity to do it. Please do just fill in the poll that's on the screen about how useful you found this so far. Just one question then to each of the panelists for 60 seconds each. I think first question for me is like, what do you really think are the kind of the key first things you've got to do to start this journey? So for each of you, so I'm going to start with Jacquie, then Preeti, then Ruth, and then we'll close this part of the session.
Thanks, William. Okay, 60 seconds. So I think, who is the local partnership that is willing and enthusiastic to be part of this? who are your local population and who is your workforce, and what's the overlap that you can understand and take some actions quickly on some of the opportunities, and where are some of the hotspots locally around both the new labour market who want to work, and some of the biggest areas that we've got in terms of gaps in health and care support.
Preeti.
Yeah, I think where do you start? I think data insights is always the best thing to start when you're looking at your own local area. So local needs versus local opportunities. I think there are three things which I want to say. One is we did not fuss a lot about, what we are doing has to be very innovative or has to be very unique. We started with some very practical bits. And make a start, because that is what will get more people around the table. It's just kind of what we always do in transformation or quality improvement. Build on current work. So as Ruth mentioned and Jacquie mentioned a few examples, whatever is happening locally, just try and build on it. Some of it would be redirecting resources. So somebody asked a question about skills, money that councils are spending on skills development. I think what helped us was helping the councils understand that we don't need more computer training. We need something else. We need, whether it's in facilities and it's just find what is already happening locally and try and build on it. Don't worry about stepping on toes. I think it helps if you're stepping on toes, because even if people are irritated, then they are going to ask you a question why you're doing it. And I think the third piece for me is what comes out of this kind of, being very practical, looking at current work, is you will find gaps. And then you will be able to identify those innovative, creative bits. So as I said, Generation Medics was one bit, but then we realized, there was some other youth work where we could connect them. And there was some other adults returning back to work where we could connect them. So the connections happen once you start building on something.
Brilliant, Ruth.
Thank you. Okay, so super quick. Ask lots and lots and lots of questions. Try to, I would say, try to avoid duplication. Jump on, piggyback on work that's already being done, and ask more questions. Communicate. Find out where the levels of engagement are, and go with those. Go with your easy wins first of all to get engagement, and make sure that you've got your county council, your job centres, your colleges involved in conversations when you're talking about employability, because they'll be your greatest assets, because they also need to do the same work that you're doing. And yeah, that's it probably from me. Cheers, William.
No, that's brilliant. Great. Thank you so much. Thank you to those of you who've got to drop off now. If you are staying on for the second half though, and I know quite a lot of you are, put yourself on mute, put your camera off. We're going to give you 5 minutes to just stretch your legs, go to the loo, grab a cuppa. But we'd also, whilst you're doing that, we'd just like you to think, really. We've got one question for you to think about, which is just reflect on what you've heard so far. Feel free to share that in the chat over now or the next few minutes. And then when you all come back shortly, in 5 minutes time, when we'll kick off, which by my watch is about 53 minutes past. So 53 minutes past, we'll look to kick off. And when we come back, we're going to just have a bit of a reflection point, connect, and then we're going to put you into some small groups to have a chat. So do have a think about those questions. Thank you to the three speakers and to those of you who completed the questions for us in Slido as well. Don't worry, those questions are going to get picked up, and I think, as we said, separately. So we shall see you shortly in about 3-4 minutes. Thanks.